I was having problems, going to the bathroom, and I went to my GP, and he told me, oh, you probably just need some probiotics. Come back in 90 days. And he put me off for a year. And finally I went in a year later and he wasn't there anymore. And the doctor I saw said, you're getting a colonoscopy this week. So I got the colonoscopy and the guy came in and he said, I'm sorry, you have cancer. We took there's a big lump of cancer in there, and we took some polyps out, but there's a big lump in there, quite sizable tumor. And you're gonna have to have it surgically removed. And they set up a surgeon, and a few days later it was gone. They never took a PET scan or a CAT scan before the surgery. He just went in and took it out.
We're assuming that everything's fine. He's not going to have many treatments. It would just be mild. I asked probably 5 times when they were going to do a scan. And then they finally did one in October of that year, and that's when they came out with, it looks like it metastasized to the liver. So, of course it was devastating to hear that. He still wasn't well, so next time I said we need to go to emergency, we're going to go to Banner, MD Anderson.
So 18 months ago, he was sent to hospice. And again, there's a time and a place for hospice. We need them, they're part of the team. But with Jim, I said, let's take another look at this. Let's see what's here. And sure enough, once we were able to tackle the infection, tackle his nutrition, chemotherapy tailored to him, and we've achieved 18 months of tumor control.
Dr. Gomez was on top of this right from day one, and I was here, I think, only a day or two before I saw her, and she said, we're going to get you well, and I'm going to get you quality, and then I'm going to get you quantity.
We have specific mutations for specific tumors and truly tailoring patients' care. And we were able to repair a pathway that was leading to recurrent abscess in Jim, and really not allowing him to bounce back, not allowing him to recover, not allowing him to provide his body the nutrients, because the infection was basically depleting him further.
Right off the bat, we had very good results. My numbers dropped. We did scans and they were shrinking, and everything was working well. I run a little business, a handyman business, and I climbed 20-foot ladders, no problem. And I left yesterday at 8 o'clock, and I got home after 6 last night, and I love doing it. And I love working and being busy, and the treatment I'm getting here at MD Anderson enables me to do that.
To be able to walk with Jim and Rosemary, to be able to walk with my patients and their families, all of that just fuels, right, my love for this, or my commitment to this. To be able to hear and see that a story of someone who was referred to hospice is now 18 months out, traveling, enjoying an air show, giving me recommendations for restaurants. There's no better success. There's no better fuel for me to show up on Monday morning.